Come in here, and then sheet up at the front. You and Sally. You just get by 112. You and I, yeah, I think yes, that was. And you sign that one. Well, this is just if you're in my class. Sorry.
See, that's why we're in trouble right now.
We talked about it a little bit later. Just want to make sure that everybody who's in here right now has signed an attendance sheet. If you're a student, faculty, or other, I'd like that you sign in sheet. If you're in my class, you should also have a half sheet of paper that before you leave, make sure to hand that to me.
Yep.
Yeah,
Questions at the end?
Yeah.
Yes, absolutely.
That's where the magic happens.
Yes, sounds good.
And I don't necessarily have to be anywhere, so
Okay.
if questions go longer, that's fine.
Perfect, yeah.
As long as there's nothing behind it.
There's nothing behind us at all. We'll get started now.
Okay.
Alrighty, folks, we're going to go ahead and get started here today. Thank you, everybody, for coming. Rogue Community College and the Science Department are proud to present the first guest speaker for the Southern Oregon Health Professional Series, and we're proud to have Dr. Matt Richardson here today. He is the owner of the Rogue Family Eye Care in Grants Pass, and he's going to be talking to us about a little bit about his career path as well as careers in optometry. So if you have any questions, write them down, save them for the end. We'd love for your questions. Just save them for the end. Make sure that if you're in here, you sign the attendance sheet, you're in my class, that you've gotten one of these pieces of paper and you give them to me on the way out. Okay, so everybody give a warm welcome for our guest speaker, Dr. Matt Richardson.
I'm going to put these on because I am old. Good thing I can do my own tests, right? Thank you, Professor Cremo, for that warm introduction. Thank you for all being here. This is a great crowd for such short notice, probably, and I'm kind of honored to be the first one in this lecture series. A little bit about myself. I'm a Medford native, and as he said, I practice in Grants Pass, Oregon. I have my own clinic, and it was a family-run clinic until a couple of the kids got older and decided to go into dentistry, of all things. I mean, come on. So anyway, how many in here are pre-nursing? Awesome. So there's a lot out there other than nursing. There's a lot of things that nurses can do, various disciplines in the medical field where they can be an important contributor to care. So today, how about optometry? And I'll probably walk around a little bit. Let me see, which button is it going to be? Oh, it's probably the mouse, huh? No? How do we advance? It's on this one, but the mouse is hooked to this one. Just click on it. Just click on it. Okay, cool. Okay. A long journey. How do we get you into school? Well, high school and community college education typically is a preparation for a bachelor's degree, which I believe in probably 99% of the schools is the most common entrance. Got to get good grades. Good grades, good grades. Typically a 3.5 to a 4-point. And it hasn't changed much since I graduated 20 years ago from Pacific University College of Optometry. And I went to Willamette University in Salem, Oregon, graduated in '99. So good grades has always been a good indicator that you're going to be competitive on admissions. Bachelor's degree, like I said, same thing. Specific classes in your core electives will determine kind of which school you're looking at. Not all the schools have the exact same requirements. Of all the schools in the nation, there's several worldwide, but there's 24 schools in the United States, one of those being in Puerto Rico, and there are 2 in Canada. So when I went to school, there were 17 total. So we've seen a huge increase in the number of osteopathic medical schools. And with osteopathic schools often come huge universities such as Western University of Health Sciences, where they have veterinarian, nursing, nurse practitioner, PA, DO, and optometry. Also, if you're going to get into optometry school, you want to start volunteering. They're going to look a lot of that. hospitals, and an eye doctor's office. You're all welcome. If you want to set up a time to come in and spend time with me, you can, as well as surgical offices. There's also something called the OAT. In my time, it was the only thing required. Now I believe they are also considering the GRE. It's very similar to the MCAT. I'm not sure why it's different, but biology, chemistry, math, English, writing, quantitative analysis. My identical twin brother is an osteopath who went on to become an ophthalmologist, which is an eye surgeon. So if you have questions about that, I can tell you the differences. But our schooling entrance requirements are similar. The schooling is very similar. But a lot of science. So that's what they're looking for, a lot of science. Also well-rounded people, for sure. Learn how to interview now. I can tell you, having sat on the admissions committee as a junior and a senior in grad school, it can make or break you getting in. Start now. I don't know if you guys have a pre-med club or something like that, nursing club, where you guys actually practice interviewing each other. I'd be happy to help set something like that up, get a few professionals in here to interview you and that kind of stuff. But like I say, it's a very huge, important part of how they're going to make their decision on admissions. So here's my roadmap. That's Willamette University, and then of course I went to Phoenix High School in Phoenix. Graduated high school in 1995 with my twin brother, co-valedictorians. We both worked at, back in the day, RVMC, Rogue Valley Medical Center, back before they had ER techs. We were orderlies, if you ever have heard that term. That tells you how long ago. We both, back then, HIPAA didn't exist. We learned how to suture. We learned how to help set bones for x-rays. We did a lot of things that a 17 and 18-year-old young male would have no chance of doing in such a program this day and age, which was a really cool experience. I attended Willamette University 95 through 99. Everybody was pre-med. Let's be a doctor. Woohoo! There was 300 of us in the pre-med class. There were 14 of us senior year at graduation. You're going to, chances are, when you go to a four-year university, you might change some stuff. You may even change it here. But what I'm going to show you is a quick way to the medical field. Pre-med, biology or chem minor, and something with psychology, for sure. Those are all great aspects of helping knock out as many prerequisites as you can get for a variety of health careers. I was involved heavily with sports medicine. I was an athletic trainer, student trainer for roughly 10 years between undergrad and graduate. While in college, I volunteered and worked as, well, then HIPAA existed, as an orderly at Salem Hospital. I ran track for Willamette Road Crew and was in a fraternity and still did all the things that you can do. You just have to be a master at balancing time. Different experiences began to shift my career interest. As I became more heavily involved with being an athletic trainer, having blew out my knee in college and having to go to the actual therapist I worked for, and knowing the different things that it takes, I started becoming more interested in that as doing a dual major, eventually doing athletic training and physical therapy. However, at the end of my college career, it's time to make a choice, and it just happened simultaneously. We were smart enough to keep abreast of what's going on, not only politically, but in the insurance world. In 1999, shortly after I graduated, Medicare canceled all physical therapy reimbursement contracts with long-term care facilities. This made up over 60% of the jobs in physical therapy, okay? So not only did you have the hottest job graduate degree on the market, producing the largest number of graduates, but you had also in the history, the largest number of unemployed. My buddy graduated a year before I did. He worked 3 part-time jobs for 6 years. And the beauty thing about that is, it's not beautiful, it's actually scary. Try to get benefits, especially if you have a family working a job that only pays you 8 hours a day. So and that went on for probably about 6 years before it started to change. And now, once again, it's one of the hottest jobs on the market. So, now that you're graduating, options, which end do you want to work with? biology, pre-med, chemistry, psychology. Like I said, both majors and minors will get you a lot of places. Physical therapy, doctorate now. When I graduated, there were a lot of bachelor degrees. There were starting to be masters. One school had doctorates. The difference between master's and doctorate really is that you're publishing research. You're furthering your career, your profession, by doing research that stands up against any doubts that insurance has about reimbursing what you're doing. Nursing, we've got bachelor's of RN, we've got certified nurse practitioners. We now have physician associates. It's no longer physician assistants. They didn't like the assistant word, evidently. And which I think that works because they're not necessarily dependent on doctors to make decisions anymore, so associate kind of makes sense. Again, a lot of these professions you're going to find at those university complexes like Western University. So for nursing, we've got anesthesiology, you've got ortho, dermatology, pediatrics, twice, pediatric emergency room. There's a lot of ways you could go to be a nurse. I try to push as many young men and women that aren't sure but they want to be in the medical field to go into nursing because guess what? We need nurses, as you all have heard over and over and over. You become a nurse, you've got a guaranteed job somewhere and you've got guaranteed decent pay. But guess what? With that comes what? Competition. It's going to be tough. You're going to have to study hard. We have dentistry, we've got orthodontics, MD, DO, and like I said, in that arena, there is so many options of what you can do. There are things that I didn't even know were possible that MDs and DOs can minor and major in. And then within, like, for instance, ophthalmology, there's so many fellowships you can do. You can do generalist, you can do cornea, which is LASIK and corneal transplants. You can do orthoptics, which is similar to vision therapy. You can do plastics, which is making everybody look beautiful and look surprised all the time. There are so many different aspects of eyes. I mean, in optometry and ophthalmology in a lot of states have very similar scopes of practice. They're, like, for instance, Oregon is one of the best for an optometrist to be in. I can do minor surgery, I can do injections, I can prescribe almost every oral medication there is to known, except we don't usually I don't mess with painkillers too much because there's not really that much of a need. But ophthalmology, we can go through that a little bit, but there are some differences there. They do more invasive surgical procedures, cataract surgery, that kind of stuff. Some of our stuff is we're limited to certain rules by state law. Every state is different. And some states, like the state of California, having practiced 20 years, if I want to go practice 5 miles over the border, I have to take 18 months of glaucoma education because they don't believe that anybody outside the state of California knows how to treat glaucoma. So there's some funny things like that. Occupational therapy, that's a big one, helping people with disabilities or born with, different physiological abilities, how to adapt to the world around them, that kind of thing. Especially with kids, that's a big one. Psychology, getting your master's or your PsyD. All these are options that pre-med and that coursework opens doors to all these avenues. That's why it's so important for you guys to come to things like this, to get out there, spend a day with a veterinarian or with a psychiatrist or whatever. See what kind of meshes with you. If it doesn't resonate with you, can you imagine being in your second year of that program and going, crap, now you owe how much money? You took student loans, it doesn't go away. Admissions, prerequisite curriculum. So this is Pacific University College of Optometry, adornedly called PUCO or PUCO or whatever. So credit requirements, and these are all based on semester credits because most of them come from four-year universities. So I apologize. Your admissions people and your registrar can convert. 12 credits of anatomy, physiology, and microbiology. 12 credits of chemistry. 8 credits of physics. 3 credits of calculus. That's a fun one. 3 credits of statistics. 3 credits of psychology. 1 English course. Statistics is fun because I remember we had a class that was like gambling. They didn't like that one. So minimum 10 hours of observation, the OAT or the GRE like we were talking about. 10 hours sounds like a lot. It's not. in our 18-hour requirement every year to establish or maintain our license, we are given 5 hours, and 5 hours is like nothing. You have like 2 conversations with a surgeon and you're done, literally. So 400. So this is just for the College of Optometry at Pacific, which is in Forest Grove outside of Portland. It's probably one of the more famous, popular schools on the West Coast because they kind of, it's changed a little bit, but when I was there, we were very well known for binocular vision, vision therapy, pediatrics, and sports vision. It was like the hub of sports vision for the United States because we were intimately tied with Nike. And we worked with professional athletes all over the United States. We had people, a lot of them would come and stay in Portland, and they would come in, we would assess them. We used to work with the U.S. ski team, all that kind of stuff, identifying athletes with vision issues and how to best provide them with relief from those problems. Every year there's 180 interviewed. The average GPA was 3.3, which was kind of astonishing to me because when I was in school, the average entering class GPA was 3.7. But again, you've got more schools, more competition, so sometimes your standards have to come down just a little bit. The average age is 25. We had all kinds of people, non-traditional students. We had 2 medical doctors from, I think it was Liberia or wherever. They came, but they couldn't get reciprocity, meaning their licenses weren't recognized by the United States. So they decided to become optometrists, and they aced every test that we had. It was kind of sad. They didn't study at all. The schools, it's a big school. Most of them are anymore these days, but it's 12-to-1 ratio, students to faculty. And most of the faculty are optometrists with specific specialties, publishing, and research as well. Let's see. Essays, letter of recommendation, kind of all the basic stuff, but a lot of it really comes down to the interview. Because let's face it, if you made it to the point where you're going to have an interview, you're good. They all know it. They wouldn't have asked you to come all that way to interview if they didn't want you. So that's the icing on the cake. And I can tell you it again, it will make or break whether you get in or not. And the criminal background check. I didn't realize that was there. This is a statement from their website. In a word, they look for strength, but not just off-the-chart achievement. In one area, they look for candidates with proven academic ability, strength of character, personality, and leadership. They want a well-rounded candidate. Because let's face it, do we want doctors that are robots? Do we want healthcare providers that are just there for a paycheck? No, they want people with passion that have things in their life that make them unique, that they can relate to people. Because really, when it comes down to that, we're all in the people business, right? So I always say, I tell my staff, everybody's got rules. I like rules. Rules are there to bend, right? We have financial rules that say, hey, payments due at time of service. But, if someone wants to make 2 payments, guess who's the hero? So anyway, just be good to people. My rule is this. That's your grandma walking in the door. Make her happy or she's going to whoop your butt. And you know what? Think about it. Any doctor that's with a patient, imagine your grandma being that patient. Would you want them to receive the best care possible, given that you like your grandma? Yes. So why shouldn't everybody deserve what you give your family? So, okay, we're in. We got accepted. The beautiful thing, and a lot of you know this from being in this scenario, is that you're all in the same boat. In grad school, you all take the same classes, you have the same tests, you have the same study periods. Everybody's there. And I'm going to tell you, going from school from 8 to 8, it's no joke. It's not much different than, I thought my undergraduate education was harder, but there was 2 times the number of classes and school hours in grad school. So, in a typical optometry school, you have the first year is 9 months, and you get 3 months off. Last taste of freedom. We decided to work on a golf course, so we mowed greens in the morning, then played till dark every night. And then you got 2 years of back-to-back, no break. You get like a 2-week break here and there, but straight through education, and then you get a year of 4 3-month rotations throughout the United States and sometimes different places in the world like Australia or wherever else. So study, 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 test, more test, study, okay? That's your life. You got to fit everything else around it. And I've talked to, even my own kids, I've talked to them about when they go to school, and a couple of my stepkids have gone to school, and they kind of did this, but not really. Do not ever plan school around other stuff. School is first, everything comes second. Jobs, sometimes relationships. Because the minute other things take priority, school goes away. And it's easier and easier to shift that balance to other things, okay? And we talked about that, The curriculum is, the first like 2 years, it's medical school, literally. Our education had more pharmacological training and education than almost any medical school in the nation. And the reason why is a lot of what we're called is just like nursing, is we are allied health professionals. Medicare considers us physicians, just like they consider a chiropractor, sometimes dentists. But you have, and this is where you understand the politics of insurance, laws, and everything else. Because with the stroke of a pen, a legislator can take away everything you have legally in how you treat your patient. So, as an allied health professional, you have to be aware of what's going on, the different laws, because there are always someone else trying to shut down your access to care so they get more. And that's a sad thing, but it's a reality. So in optometry, eye surgeons of the old school, believe that we have no business doing certain things in the eye environment because they're unaware of what our training is. So our training is top-notch, above and beyond maybe what should be used, so that when we are questioned, there's no validity to questioning our skills and ability. Does that make sense? Okay. And these are some of the different things. There's, vision therapy, there's a huge thing for bilingual people as well, especially in this part of the United States. Spanish is a huge one. A lot of mercy missions to foreign countries and Mexico and wherever else. Because you're helping people, number one, but number two, you're seeing some of the stuff you will never, ever see anywhere else again. Third world countries have a lot of vision issues because the life expectancy is different, the quality of life is different. And honestly, when you're close to the equator, the UV light index is so much higher. Like cataracts, which we typically see in the 70s and 80s, we see them in people in their 40s that are ready for surgery. So those are good. If you can go on a mercy mission as a nursing student or whatever, do it. You're going to see some really cool things, and you're going to help people, okay? School is just not for studying. And this is what I was talking about. You learn to incorporate everything. So in optometry school, I had one of my best friends who practices in the Dalles, used to play for the San Diego Padres, okay? So he was on our intramural team, and a girl I went to college with who was the NAIA Division I Player of the Year for the United States 3 years in a row. She was a soccer player. She was also the first female to ever score in an NCAA Division football game as a kicker, and was invited onto the Tonight Show with Letterman and all this stuff. She was in there with us too. So we pretty much sweeped every intramural division there was, and the undergraduates did not like us. We had an indoor soccer team. It competed in Portland. Hiking, there was ski trips. I mean, there's all kinds of stuff. Because guess what? You're all in the same boat. So guess what? You all got to cut loose and do something once in a while to break the monotony. Because you can only, when I used to visit my brother in medical school, all of his friends used to give me a ton of crap. They would be like, so it's 4 years, it's 2 years per eye, right? Yeah, no. So it is a lot. It's a lot. Because basically, you're memorizing everything that's neurological. You're doing systemic disease. The eyes are part of the brain, so everything's affected the same way. So you got to be on top of it, and there's a lot to do and a lot to know. We used to do fundraisers for vision stuff. We used to go to the Duck games. I was on the Nike research team. One of the biggest reasons I went there is because of a doctor named Alan Reichow, who was the head vision consultant for Nike. He was actually an employee, and he was our sports vision director at Pacific University. Did you guys, this may have been before some of your time, did you guys ever see the Nike MaxSight lens? Bausch & Lomb came out with it in, I think it was 2005. No? So that was my senior thesis. There was about 20 of us that developed this lens, the tint, did this statistical analysis with both college baseball, soccer, softball, and a few professional athletes. So the problem is, later on, I was on the U.S. Sports Vision Council for the American Optometric Association, and B&L came to us with Nike and said, hey, should we make this into a monthly lens or a daily lens? Well, knowing athletes, for most of my adult life, I said, hey, you got to make it a daily. Athletes are superstitious. They get comfortable with something they don't want to change. So you put a lens on them and then you make them change it every month, they're not going to do that. If you make them a requirement to change it every day, that makes sense. So what they ended up doing is they would wear the lens, never buy the supply, and the program went bankrupt within 2 years. Now, this technology had a patent on it that expired 3 years ago. And the two guys that were my mentors are now in Ohio, and they actually recreated the company. So it's the same technology. It's available today. It's called Altius. So that's something kind of cool. So if you might want some really cool eyes and see really well in low light conditions. If anybody follow baseball in here? Okay, so our batting average increase was 30%, which is unheard of. Unheard of. Funny story. So two things I remember being on this team outside of the research department was I went onto campus one day. We had a meeting, and it's in Beaverton, Oregon, about 10 miles from where we went to school. And I was a runner. I always wore Adidas Response trail shoes. That's what I wore. So we're walking down the pathway to the Lance Armstrong building, and security stops us. And they're in their little golf cart. And he says, sir, we need your shoes. And I'm like, what? He's like, I need you to hand over your shoes. You're not allowed to wear non-Adidas product on your feet. So they took my shoes, literally. So I'm walking in my socks, and we're walking, and then they come back, and they give me a brand new pair of equivalent, I can't remember, I think they were Nike Pegasus running shoes. Said, don't let it happen again. Tried it again, they said, nice try. So yeah, don't wear Adidas there. A lot of people don't know this. Because of our research team, which was all like seniors at the school, Nike created the most distortion-free sunglasses on the market. Nobody came close. We created all kinds of weird stuff using Heaney lasers, and I mean, we're like Bill Nye the Science Guy, only actually smarter, putting this stuff together. But about 5 years after I left, they got rid of the vision department because of industrial espionage. I'm like, that's some 007 stuff right there. Like, someone stealing trade secrets, I guess, I don't know. We worked with all kinds of professional athletes, everybody from David Duvall, if you guys know who that is, Casey Martin, Stadler. Anyway, maybe some of the older people don't recognize those. But they're just people like you and I. Sometimes as they get older, they develop issues and inadequacies to compensate with their age, and it's our job to help them out. And luckily, we did that. You can work as a disease technician. Like, there's jobs that pay you to learn. It's the most beautiful thing in the world. That one of the cornea right there with the circle, that's amoebic keratitis. One of the rarest things you can find, one of the hardest things to treat. The main ingredient in the medication for that is pool cleaner. Straight up. Because you're not dealing with a bacteria, you're dealing with an inobligate parasite. And what's interesting, I know that they've been changing the water treatment in the valley. I had one of these show up in my office like 4 months ago. It's my friend's kid. Okay? She used tap water to clean her contacts. Didn't have saline. Senator John Welling over at Medical Eye Center, who's a corneal specialist. Same thing my brother does. My brother's back east. He's over here. And he said that's funny that we see that because we haven't seen one in 6 years, and this is the 4th one this year we've seen. So contact lens care, that's why you do it. This other one is it's a central retinal vein occlusion. That's high blood pressure issues later in life. We call that blood and thunder, obviously, for it looks like blood and thunder. So, but those jobs like that in school that you can actually make money and learn things beyond kind of what you're going to learn in the classroom. Because let's face it, nothing is ever textbook, right? Those of you who maybe have done some hands-on learning, never textbook. And then translator. I spoke Spanish since like 6th grade, okay? I'm as Scottish as they come. When I go to Mexico, the people are pumped. And I'm like, más lento, por no entendido. But I did translate Spanish in the clinics up in Portland. There's one called Virginia Garcia. It's a dentist and optometry office. And we see migrant workers and people that don't necessarily have the best English. Do I use it down here? I'm going to tell you, there's a 50% chance if you're seeing a patient that doesn't speak very good English, they're either from Zacatecas or Michoacan. I've seen people from Guatemala, Colombia, Peru. It's helpful. It takes me a little bit of time to get back into the swing of it. But as medical professionals, just remember this. There are powers that be. For instance, the state is right now passing a mandatory law that if you're a provider that speaks Spanish, you have to pass a translator's test. And it's over the phone. And I have spent the last year dragging my feet because speaking on the phone is one of the hardest things in the world. If I get someone that calls the office, the first thing I ask them is, do you want to make an appointment? If I'm controlling the conversation, I know what I'm looking for. But it is the hardest thing ever. And so, for instance, All Care, who's one of our, is basic, it's more so on the north side of the valley, very similar to Jackson Care Connect on this side, is saying, hey, if we can certify you, then it counts for the state. That way, I'm not liable if I don't hire a Spanish translator. Because that's their goal. They're trying to create jobs. If I don't speak the best Spanish, I'm not certified. Every time I have a patient that's not English speaking, I have to hire somebody to come in and translate. It's the same kind of rule that exists for people that are hearing impaired, et cetera. So, all right. So we've graduated. Yay, you rocked it in the classroom. Now what are we going to do? Various paths after getting your OD. OD stands for optometric doctor. Residencies. Holy cow, more school. A lot of these had just started when I got out of school. Pediatric sports vision is kind of one that's put together. That was my emphasis in school. I did a ton of kids, learning disabilities, that kind of stuff, binocular vision, and obviously sports vision was my deal because of my sports background. Children are one of the most underserved populations there are. And I'm telling you right now, it is much different than adults. That's why if you see a doctor who's not used to getting kids and they get a kid, ooh. I have seen kids for over 15 years. I think they're easier than adults because 9 out of 10 times they're super stoked you're there, especially if you have stickers. And it's all a game. You're just playing with them. They don't even know you're doing an exam. Low vision. Okay, low vision is kind of one that a lot of people, it's not sexy. It's not about shooting lasers or fitting, life-changing contacts. A lot of it is the elderly. We're talking macular degeneration. Nisha's not on call. Hey, it's my twin brother, the ophthalmologist. It is probably one of the most underserved areas in the adult world in vision. And basically, it's a lot of hand-holding. It's a lot of complicated physics because you're taking someone whose vision is dwindling and trying to enhance it so they can function. We used to have a great low vision guy in the state. There was like one. He was in Roseburg, but he retired. So we're still trying to find someone locally. I dabble in it a little bit, but once you get known for doing that, then that becomes a lot of your practice. And I'm more of a family kind of kids guy. I've always said that. So there's a need, let's put it that way. Medical surgical disease. When I was in Lake Havasu, Arizona on one of my rotations, I worked for a place called Eyes of Arizona. It was an optometry ophthalmology clinic where there was a huge synergistic relationship between both professions, and it was an ideal example of how it should work. We as the optometrists were we were the gatekeepers. We were the primary care doctors of the clinic. If we found something that was worthy of a further evaluation for surgery or whatever, boom, we kick them over to the ophthalmology department. When they're done, they come back to us for the recovery. Boom, you're good to go. And that's how it should work. One of the optometrists I worked with, everybody heard of Baskin and Palmer at University of Miami? Okay. Baskin and Palmer, one of the most advanced research centers and internships / residencies for almost any profession medically. The optometrist I worked for had his fellowship from there. I had a shoe in there, but I decided to get married, and sometimes I wish I would have gone. But I didn't think I needed it being in such a small town, and there's sometimes I wish I'd had some more of that experience. Contact lens. A couple of my friends are contact lens experts. There's a lot of advancement in contacts. Recently, we all look and hear about silicone hydrogels. Silicone, and with that came the death of colored lenses. Wah, yay. They breathe literally 100 times better than anything we've ever had on the market, which means less disease, less corneal problems, less corneal transplants. Everybody know what Pseudomonas is? Ever heard of it? Pseudomonas is a bacteria. It's the only bacteria that can breach the mucous membrane without insult. So I've known people that have had Pseudomonas in their ear, almost lost their hearing. If it sits on the cornea too long, it'll eat right through the cornea, and it is a you-know-what to treat. And the reason why is because contact lenses of the past were like putting cellophane on your eye. The eye absorbs oxygen from the environment. If it doesn't, it becomes anaerobic, so it produces a lower pH, and it's dark and warm when you sleep with it. Guess what environment grows? Pseudomonas. So when I was in school, our contact lens leads were the two top leads in creating sleepable overnight wear. Okay? And the one that survived was Air Optics Aqua Night and Day. I still don't believe it's a good idea because there's all other kinds of bacteria like strep and staph. They can still cause ulcers. It's just not as devastating as Pseudomonas. You can work for eye surgeon clinic. Two of my favorite ones are Medical Eye Center. There's a whole host of doctors there, but Dr. Olive has been my friend for over 22 years. Great doctor, great surgeon, good friend. Across the street from them is the Cataract and Laser Institute. One of my longtime mentors and colleagues who just retired 2 years ago was Dr. Paul Schultz. Phenomenal surgeon. A lot of the greatest surgeons I run into are military docs that went into private practice. I didn't list that here, but the military is a wonderful avenue. They have what's called the HPSP. Anybody know about that? The Health Professional Scholarship Program. With a bachelor's degree, if you apply and you get into school and qualify for their program, they will pay 100% of your schooling, your books, your fees, your stipend for living, etc., in exchange for typically 4 years of service in that profession. My twin brother did that. He went on to become the head of ophthalmology at Wright-Patterson Air Force Base, went to Keesler Air Force Base for a while, then he has diabetes like myself, and when you get to a certain age, they try to clean house of anybody that's either not advancing or has medical conditions. So his best solution was, I'm going to deploy myself. So he did, and he came back. He retired immediately and transferred to the Air National Guard, kept his retirement, and now he's a flight surgeon for an F-15 squadron out of Massachusetts. By the way, quick story. His first, they broke the two weeks a year in the Air National Guard into 2 1 week. So he got to fly with his fighter squadron to Hawaii from Springfield, Massachusetts. So it took them 4 hours flat to fly from the East Coast to Hawaii. They told him he couldn't drink anything like 6 o'clock the night before. So, oops. There's corporate optometry. I left my first job after 10 years. There was some family stuff and whatnot, but I tried to make the most of my experience. So I worked for a private clinic in Medford, and I ran all of the Walmart Vision Center contracts and had doctors working for me at those places. As a referral network to the other office, because we had specialized testing equipment, but also because I wanted to see if we could actually create actual clinics in those places, and we did. We actually got national recognition for having the most consistent schedule of any office on the West Coast, so it was kind of cool. You can make good money, make a lot of money. You're going to work hard. You're going to see 25 people a day, which is a lot. But you could probably start out working there and make $100,000 a year easily. But there's a cap. There's only so far you can go in that arena. You can work for a private clinic like Group Eye Care. That's Taylor Oberly over off of McAndrews. And there's our office there. That's our sign in Grants Pass. Private clinic, you got pretty much total autonomy. You can do whatever you want. You're the last man standing. You have to answer for everything that goes wrong, and you can dance and pat yourself on the back for everything that goes right. I've done a bit of everything. I've worked for corporate. I was a professional lecturer in the United States and in Europe for Hoya, which is the second largest maker of, you guys know what progressive lenses are? Okay, for the second largest producer of those in the world. I hope to get into that someday back, because it was a good gig. It was fun. Research. There's a lot of optometrist opportunity in research. Johnson & Johnson, their division of vision is called Vistakon. Of course, Baskin and Palmer, you're telling with like medical research. Nike, I think there's a couple other new vision. I know the military is huge. A lot of times we came up, we were involved with a study that took a lens that had micro batteries in the arm of the frame. And you would push the button and it would change the thickness of the lens and it would allow you to read through what you couldn't read before. Okay? Guess who stole that instantly? Military. They bought the patent, haven't heard of it since. But, you know, we're talking about Iron Man and, you know, Marvel, all the stuff. Push the button and it zooms in. That's almost exactly what they're trying to do with that technology. Or you could be a teacher. Having that kind of degree, you could walk into any optometry school and apply for a job. And usually you start out as an associate professor and then work your way up the ladder. But what a great job. I mean, paid leave, get to go all to the educational conferences. It's a lot of fun. Or work with ophthalmology specifically, plastics, retina. Retina is a scary one. That's the one where those are kind of like the kings of surgery when it comes to eyes in the last road. But there's also neuro-ophthalmology, but that's even a little more different. I'm a firm believer it takes 5 years to be competent as a doctor, maybe less as a nurse, because I think you guys are, especially if you're like ER or really fast-paced stuff, the more you see and experience, the better you're going to get. And I also believe the more you see, the more you're going to realize you don't know. And that's okay. I would say it's called practice for a reason. I always love, we're going to start again, but I had for 10 years, I had doctors coming in, those 4 rotations. We'd have one every 3 months. And it's funny to watch the new ones. They're all excited. They know everything. Oh, this is that. They're looking for zebras, and every horse that walks by is a zebra. And then by the time they're done, the 4th year, you see so much maturation in their thinking and the experience. It's kind of nice. But when you get in the real world, man, it's tough. I always recommend being part of a group because that's an instant second opinion. It just makes things a lot more helpful. So these are some jobs in our field that are out there that, and I didn't go into them too much. You can ask questions later about, but administration positions. If you're in hospital administration, man, an eye clinic is a great place to work because there's little overhead, there's not a lot of complication, and there's lots of money to be made, okay? Same thing with management. Billing specialists. Billing specialists, it's just like medical billing because we do bill medical and vision. Lots of opportunity there. Certified opticians. Opticians, that term has kind of changed over the years. They used to create and make lenses, and now it's more about the fit, the type, knowing all the different aspects, ins and outs of materials and coatings and thickness and optics and all that kind of stuff. There are some that still fabricate on a limited basis. Technicians, it's kind of like the doctor's assistant, basically. Depending on the setting and the emphasis of the clinic, it can determine the job description. But they act kind of like an MA in my clinic. They do most of the pre-testing. They do case history. They help with contact lens fitting, minor surgical procedures, that kind of stuff. Nurses. My sister-in-law, my brother's the ophthalmologist. His wife's a trauma nurse, but now she works in his ophthalmology clinic. I think there's like 12 ophthalmologists. It's a referral center. And everything. I mean, surgical injections, pathology, minor procedures, all kinds of stuff. In most ophthalmology surgery centers, a nurse is typically the surgical director under the head of surgery, which is usually the owner. What do I like about my job? Seriously, it's the best job in the world. It really is. Being a doctor is not hard because if you're competent and you're confident, and what that means is that you don't know everything. I know my limits. I try to treat everybody like family. I don't experiment. If someone has no money, no insurance, sometimes I'll do things for free because I know if I send them to the guy down the street, it's going to cost him $3,000 to have the same thing done, and he can't afford me to charge him $40. So we try to help where we can. You don't want to put your whole life professionally on the chopping block either. So know your limits. Treat every patient like they're your mom. Yep, you like your mom. Err on the side of graciousness, not greed. There is a fine line. Again, right now we're dealing with a huge change in insurance. Employers, especially large ones, change insurance, and nobody asks which providers are taking it. They go with what fiscally makes sense for them. Right now, Blue Cross Blue Shield, which used to be the best premier insurance in the world, highest reimbursement rates, all of us set our numbers for what we charge based on what they reimbursed, is starting to lose favor with almost every major group because of failure to pay. And I'm not sure why that's happening, but we're seeing lots of pharmacists dropping it. We're seeing patients switching and school district switching. So it's always a good thing to make sure that you're not following that suit. We take insurance. A lot of people don't want to take OHP. They don't want to take state assistance. Well, guess what? Who is state assistance number one client? Children. Okay? I'm a pediatric guy. That'd look pretty stupid, wouldn't it? So, be timely and communicate. It's all about communication because patients take communication as a sign of respect. The number one rule or reason that people get sued is patients feel disrespected. That's why I always say I treat them like family. Do you have any other questions? If you do, here's my card. And guess what's on my card? My cell number. Every single patient for 20 years has gotten my cell number. You know how many times I've been called at home? 3 times in 20 years. Because they felt that was a sign of respect, so they're not going to abuse it. Here's a hard one. When you're wrong, own it. But I'll tell you, patients will give you their loyalty and they will listen to you because you're being honest and you're human. 100%. If I can teach you one thing, it's be humble and be honest at all times. It will always come back to bite you, every time. May not be for 4 years, but it still will. But have fun. The last thing we want to do is go, oh my God, I've got to go to work again. Enjoy what you do. That's why you are right now where you are. Find out what that is. And you know, you may think that certain aspects of nursing are bad, but guess what? There are a ton out there that are amazing. Just like in optometry. I didn't necessarily want to do low vision and deal with people going blind all the time. But it's a needed thing, and there are a lot of people that are gifted at doing it. So take some business classes, personal finance, one of the biggest ones. Because guess what? When the money starts flowing in, it's like, yeah, pay your student debt. Pay your student debt, because guess what? You're going to want a family and a house. You get in trouble with the IRS or a collection agency, good luck. It's tough. Get a financial advisor once you start making money. Get somebody that knows more than you. I can work on my car. It may or may not run. But I don't try to fix things that I know someone else can do 100 times better. I don't want someone else doing their own eye exam. So guess what? If I give, in a small community, especially like ours, here and mainly Grants Pass, Cave Junction is even more so. But if you support other people, they're going to support you. And that's kind of how it works with small business and the health field in the small towns. Be generous with your time, attention, and pay. Let's see. How many here have worked with special needs populations? And I know that's a really small word for a huge group of people. It's a super important thing. Get comfortable with it, because you may be the only option. Working with pediatrics, I see a lot of kids that are Downs. I see a lot of psychological issues. I see kids with autism, all educational challenges, all kinds of things. Just remember this. I say this a lot when I have students for the kids. I used to work with what's called the Opening Eyes program, which is a visual assistance program with the Special Olympics. It happens at the state games. It happens at the national games. And what it is we have a team of doctors, optometry students, and opticians that get together, and they give a set of sports spectacles and street spectacles to every athlete there, which means they all have to be evaluated and tested on the scene. And I tell my people, if you can work with this group, this population, you can see anything, anywhere, anytime. Because they're somewhat difficult, they have some health challenges, but they're usually very gracious and excited to be there. And the biggest thing to understand is that we're all the same. You look somebody in the eye from a foreign country or someone who has a challenge, they have the same dreams, the same fears, the same hopes that you do. And that's, if you can harness that and understand that, man, you're going to be successful. Everybody's going to, because you can relate to anybody. What do I not like about my job? Running a practice is tough. I mean, it is literally. I mean, there are taxes and fees and licensure. Try doing your own licensure with insurance. I mean, literally everything but one toenail and your second child's big arm or whatever they want proof of. Don't be cheap. If you're an owner of a clinic, spend the money on quality support staff. Pay them what they're worth. If you pay someone that's talented what they're worth, they're not going anywhere. And they'll put up with your quirks and some of the stuff. But, I mean, it's a super important thing. Hire a biller. So my first job, I was there for 10 years. The manager was there. She was a little bit older than me. When I left and I started my own clinic, things there changed a whole bunch while the time I was gone. And so she called me up and says, hey, can I come work for you? And I said, absolutely. She's a certified biller, you bet. And it just had happened that my biller got sick with cancer, and so she had to retire. She's with me today. It's been 6 years. She left for a little bit because there was some family stuff, and I tried doing it myself. Again, fixing my own car. And I was trying to decide how the CPT was with the modifier and if it went through the clearinghouse, and I'm like, I know how to fix this. And I went, doo-doo-doo-doo. I'm like, hey, how you doing? Name your price. And she did. And you know what I said? Can you start Monday? Best decision I ever made. Guess what? I sleep again at night. And I may be paying her maybe more than she's worth, but is my sanity worth that? Absolutely. To everybody around me, including my patients and my family. Have a quality optician that knows what they're doing. Anybody can sell stuff, and that's easy. It's like selling a used car. Hey, it runs. But when something goes bad, can they fix the problem? And really, including medical stuff, problems with glasses, what do people want? They come in with anxiety, and they're like, I got this problem. All they want to hear is, we'll fix it, right? That's all we want. My car's making a weird sound. Do you see them go, I don't know. We'll call you in 3 days and let you know if we can do it. No, just reassure them you're going to do everything you can to fix it. And have an optician that actually can, because I'm telling you, I've broken a few pair of glasses. Train people that have good personalities. I can train a monkey to push a button, but I can't train people to enjoy people. And when I first bought my clinic from a guy who'd been there 42 years, okay, he's 77 today, or this year. I inherited a staff member that it was the first person I've ever had to let go, and it was the hardest thing I've ever done. But I gave everybody a clean slate when I started, and there were so many blatant things. And I remember talking to him before I did, and he goes, yeah, I probably should have let her go like 10 years ago. And I thought, hey, thanks a lot. I appreciate it. Now I get to do it. And you know what? You got to do what's best for the clinic. The clinic and the service you provide is bigger than you. It's all bigger than us. It has to be, or it's just us, hearing ourselves talk, and you come out of an exam, man, I just did the best exam ever. It's not about that. It's about what the patients think. And if you really want to know what patients think, open yourself up to social media. We have a 4.9 star review that's true, and it's not purchased. And I never look at it until there's something below a 5, which we've only had 2. One was from a lady who was from New Orleans, who I've never seen in my life. And the other one was from a lady that called and didn't like our prices. So, yeah, fun stuff. Find people that are personable and trainable. Be prepared to work hard. If you own your own business, you are the last one standing. Well, I'll have my manager with me because I'm not going to let her go because she can do the billing. Couple things. Some days are horrible, and I will try to keep it together. We spend all kinds of time and sweat and tears in school to learn all kinds of things that we can diagnose and treat and help. But I remember Dr. Ken Eklund told me this. He said, I don't care what you do. You can learn how to diagnose with an ultrasound. You can learn how to take HD, 3D pictures. You can do whatever you want. But the best test that you can ever learn how to do and do well is to listen. And he is so right. And every time I've lectured at the university, I keep saying that to these young student doctors, is that if you truly go into a situation and listen, they will tell you what's wrong. 100% of the time, they will tell you. And what makes a good doctor, especially when you're working with kids, you try to get it out of a kid. I see these spaceships that fly around all over the place. And you're like, what's he been eating? You have to learn what they're saying. You have to be able to decipher and translate it into doctor speak. But don't go in assuming just by what they look like or what they've seen or how they appear. I mean, okay, don't judge a book by its cover. But it's true. Listen, they will tell you. And I'm going to show you 2 cases about why this was. So this is I don't remember this kid. I remember the case, and I remember the look on the parent's face. This young boy came to me. It was about my 4th year into my career. Of course, I had 5 partners, so it was, we're confident. We can do whatever. We save the world one eye at a time. And this little boy was having some kind of wandering eye thing, and I thought, wow, that's not right. He's, being young, you're the strongest, you're the most alert, you've got the most capable visual system you can ever have, unless something's wrong. Well, I looked back in the kid's eye and I went, my heart sank. And I should have attached a picture, but there's nothing that would do justice of what I saw. But when you look in the eye, you expect to see this nice, kind of pinkish orange retina with little blood vessels running through it and little sparkles where the central vision is. It looks great. This thing had this mound that came up at me like this, and it had blood vessels running on it. So something was pushing from behind. Okay, so now you go, what? Differential diagnosis. You're like, cat scratch fever, blah, blah, blah. And then you think, oh, or is it a tumor, right? That was Arnold Schwarzenegger, by the way. So at this stage, you don't know. There's no way that you can, just by looking at it, at that stage of my career, know what it was. We have something pushing from behind, distorting the retina. So told the parents, I said, hey, there's something really wrong. We need to have it looked at. Of course, what is it? What is it? Well, it could be one of like 50 things, but the worst case scenario, we want to make sure it's not a tumor of some kind. This is what we're going to do. We're going to do something. We're going to rule out the worst case scenario. So, of course, the parents just look like someone punched them in the gut, whatever. So call the pediatrician. Here's another, and I'll say this later. Have a connection of network. Know your specialists. Understand who they are, what they do, because Sometimes these situations are going to depend on you and your professional opinion and your ability to act. So anyway, so we went through, talked to the pediatrician. Kid drove up to Portland, University Hospital is where all the magic happens. Sent him up there. He went to KCI Institute. Kid had malignant melanoma at age 10. So not only the eye, but all through his head. Kid died 2 weeks later. So that's a tough nut to swallow 15 years later still. I don't want that crap on my resume. I don't want to be the one that found it. I've probably found at least 6 cases of melanoma that ended up killing somebody. And a lot of it's because other doctors weren't willing to listen. They didn't look, and they have more diagnostic capabilities than I do. So that's a tough one. This one is a really tough one. This is a picture of my friend's daughter. In May of this last year, she came in for an eye exam. Was having some headaches and had a little bit of weird double vision. She said every once in a while, things just kind of blur and they split and they come back together. So in my head, I'm thinking, God, that could be anything. She probably needs glasses. Maybe she's some astigmatism. But then I kept thinking, and she doesn't really have a family doctor. Her family doctor retired, and I was thinking, you know, she's young. She's young, which means what? She's supposed to have the 20/20 vision, no excuses unless something's wrong. She should have all the visual capabilities. Something's wrong. So what did I do? I called the ER, and I talked to one of the physician on duty, just happened to be a friend of mine. I said, hey, I need an MRI with and without contrast. We're looking for vascular changes. We're looking for white matter, anything abnormal, and I want 1-inch cuts through the optic nerve. And I didn't hear anything. Called the mom. Mom said, we're still waiting. So about 2.5 hours later, I'm on my way home, and she calls me, and it's really loud. I'm like, what happened? She goes, we're being life flighted to Portland. And I was like, whoa. So her cerebral spinal fluid pressure was 6 times normal, which, you know, we think hydrocephalus. Well, she's way too old to have hydrocephalus. So we're thinking, okay, does she have benign intracranial hypertension? That can cause double vision. But what they found was a mass on her pons, which holds all of your innate parasympathetic stuff, breathing, heart rate, all that. So she went through 2 surgeries to put a shunt in to relieve the pressure, which technology is amazing. They have a shunt now that detects a pressure that via the iPhone you set what pressure you want and it'll release it as the pressure gets up. Kind of amazing. She's been through the ringer. She came home, looked normal, acted normal, no more double vision, no headaches. Graduated high school. And I talked to her mom. She said, you know, she's having trouble walking a little bit. I'm not sure what's up. So I said, well, have her come in. So she came in, we took a look at the eyes. Eyes were fine. Her verbal ability had changed, sounded different, and she was shuffling. And so they had already kind of pieced this together, and it was like, okay, get back up there, talk to him. And when she originally had the first scans, we had looked at her mom, and her family's been great. They've kept me in the loop on a lot of it. Sent me the MRI, and we looked at it, and we looked at the report, and my first thought was glioma. Glioma is an inoperable, typically untreatable cancer. Most people have a 3-month prognosis. They said there's no way. They had a tumor board from UCLA. All these different universities have these great meeting of the minds to discuss what it is. 5 months later, this is now September, October-ish this year. Things aren't getting any better. Okay, it's time to do a biopsy. Well, the biopsies are dangerous because it's on those centers that control all major parts of life. But things are digressing, so it's time to do something. So we did a test, it came back 2 weeks ago, glioma. Now, there's 2 different types of glioma. There's a type that adults get that has a poor prognosis, and there's something called pediatric glioma, which is slower growing and has more treatment options. It appears as a secondary review that that could be what it is. But she's 18 years old. And she has a long difficult road ahead of her. She came in and saw me, and I got her some better glasses, so now she can see better, and she's super excited about that. But that's a picture of her. She just went to the beach this weekend, and it says, hazardous beach, and her mom wrote, she's not afraid. And I guess the point of that story is to remember, actually I think I wrote down the points because, yeah, know your stuff. It can make the difference. In some of these cases, even though you're not the primary go-to, you're going to catch something somebody missed. And you know what? It's called practice for a reason. Remember that. Don't be afraid to take a chance. Worst case scenario, you're wrong, and someone may go, well, why'd they do all that? It wasn't a big deal, but what if it was? And it has happened, I can tell you, in 20 years. Melanoma's on the rise. I've caught 4 iris melanomas in just the last 12 months. It's out there. The stuff is there. You just got to be willing to look. When in doubt, refer it out. That's the... I'll never forget. Freshman year, or well, freshman would be senior year, first year of internal rotations. We had a doctor named Jerry Mallory. He was a VA doctor, crusty but smarter than a whip. And we had this baseball player who was probably still inebriated from the night before who came in for an evaluation. And he had this smoldering infection that was just, it wouldn't go away. We had him on drops and all this stuff. And he looked at it, he looked at the history, he goes, dude, that guy's got chlamydia. And we're like, what do we do? And he's like, refer it out, refer it out. So yeah, when in doubt, don't be afraid to send it. Like I said, that key network of people. Know what you're doing. Don't be the last person to see that person. Okay, enough dreariness. Fun facts about the eyes. Cornea, you guys know what the cornea is, the clear front part of the eye. When you get poked, that's what hurts. Iris and pupil, color filter, opening that allows light into the retina. Lens is actually a crystalline protein that changes shape to change your focus of light. The retina, cones in the center of the retina, called the macula, that's what gives you color and detail. Rods remaining in the outer part of the retina, that detects light and movement. You guys ever looked at a star and it disappears? And you look just to the side of it and you can see it? That's because your cones can't see it, but your rods can. And it's because it's flickering at such a fast frequency that rods don't detect it. I mean, the cones don't detect it, but the rods will. And that's a fight or flight thing. And most animals have especially nighttime animals, have lots of rods because in the periphery you want to see that movement because it could be a predator. Or someone asking me to borrow money or something, I don't know. My kids, number one. All irises are brown, believe it or not. All that matters is the amount of pigment. And albino is kind of a whitish pink. Goes blue, yellow, green, hazel, brown, dark, dark brown. I have known one person in my entire life that has yellow eyes. I can't remember her name. It was a girl I went to college with who was a photographer for the paper. And she had like cat eyes, and they were really yellow, bright yellow. It's the craziest thing. Optic nerve is not a nerve. Now, there's a lot of controversy out here, but I will stand up to anybody about it. It crosses, it's a tract. It's way too big to be a nerve. It has multiple nerves in it. I tried looking up the exact number. It was so many million nerves go through the optic nerve, but it goes through a fan-like, through the optic chiasm where it crosses, and then it goes into optic radiations that go through the parietal lobe, back to the occipital lobe where the visual processing is. That whole setup is why they always say we can see strokes, we can see things that happen. Because if I can map your visual field and I see a defect, I can tell exactly where it is between the front of the eye and the back based on that pattern. It takes time and it takes a really good test result to get some of the finer facts. For instance, I'll tell you a thing. This is maybe controversial, but whatever. I had the COVID vaccine in August of 21. I don't do well with vaccines. Within 18 hours, had heart and lung failure, okay? I ended up having a trilayer blood clot, and I threw a clot after I got out of the hospital. I had a stroke, okay? The stroke that I had caused me to not be able to read for about 8 hours. I thought my weird crap meter was maxed out. Nope. And so when you know what's going on, it's more like, damn it, I had a right visual field defect as well, okay? That's Broca's area. That's the communication interpretation area, and it correlates to your right field. So when I talk to my ophthalmologist buddy, I'm like, hey, we got a problem. I knew what to do, and we got on it so quick, I got my vision back. Most people will go 2 or 3 days before they realize there's a problem. So know your body. Money. Bands about. Let's see. Average optometrist starting expect 70 to 120,000 depending on mode of practice. You're going to work hard. Owning your own practice, you can bring anywhere. You can get $500,000 if you do it right and you own everything outright and you paid off your bills. State of Oregon requires 18 hours of education annually. One of the cheapest liability insurances in the world is $800 a year. So what is it? I think 10 years ago, OBs, something like $65,000 for a basic policy. There's so many lawsuits over childbirth, it's ridiculous because every genetic problem is always the fault of the guy delivering the baby or the lady delivering the baby. Overhead can be expensive. It's not too bad. I mean, frames, depending on how bougie you want to get. Equipment, typically affordable. Super important getting involved in maintaining your licensure by supporting local societies and things that they always say, donate to your political action committee. It's an insurance policy that makes sure that you keep practicing. And that's it, because questioning where the magic happens. But like I said, there's my email address, my phone number. You guys, if you want to come see what it's about, come spend a day, whatever you want to do, send me an email, we'll set it up. And I don't have to be anywhere, so if you guys ask questions, I'm not in a hurry, so I took the afternoon off. Yes?
Some of us are coming to you from microbiology. I really enjoyed the conversation about the Pseudomonas and the cornea. Do you have another specific example like that?
My undergraduate degree was in mycology. I studied at Willamette under the first female mycologist. Yes. Contact lens solutions. Every contact lens solution out there claims to be the best about limiting bacterial growth and things like that. There was cases about 8-9 years ago where people were losing their eyes, mainly in the South, because rampant bacteria. I'm going to sit over here. I'll sit here. Bacteria, certain types of, like I said, inobligate parasites and whatnot, were kept because there's a difference between bactericidal and bacteriostatic. Bactericidal means death. So if it kills bacteria, it's going to destroy the cells of your eye, right? So they don't use bactericidal, they use bacteriostatic. Bacteriostatic means it removes it from the lens surface. The problem is 90% of probably kids, probably 50% of the population that wear contacts, would be putting contacts in their eye out of their container, but never ever changing the solution for a whole month. So at the end of a month, all the bacteria that's in your eyes, which there's natural strep, staph, all kinds of stuff, come off the lens into the container. That's the petri dish of all petri dishes. Because the solution's got propylene glycol in it and a bunch of other things that are food source for bacteria. So when I teach people to do contacts, I say, hey, at the end of it, when you put your lenses in, dump out the solution, dial on a bacterial soap, scrub it with your finger, rinse it with tap water upside down, air dry. Other cases, the inobligate parasites, not the Pseudomonas, but the amoebas. Those are the rough ones because there's really not a whole lot you can do. At about day 6, when you realize that nothing you're doing, like moxifloxacin, fluoroquinolones, or any of that stuff, antibiotics, are touching it, and the pain gets worse and worse, you really should refer it to a corneal specialist. Luckily, I have a really good relationship with ours in the Valley. Called them up, got them in within an hour, and they didn't even know what it was at first until the next day, and they saw the circular pattern developing, which usually is like day 10. You know, another one that's interesting is viruses. Especially with as many baby boomers that are starting to get into older age, we're going to see more and more shingles. We're going to see reactivation of herpes. And herpes simplex with contacts is tough because if you've had an outbreak before, it really does destroy the sensory nerves in the cornea. So you can have outbreak after outbreak and not even know it. I've had people come in for an exam and their cornea is just full of scars and they don't know why they can't see. And they'll say, well, yeah, my eye got kind of sore a couple times over the last few years. But that's, I think, if you're a contact lens wearer, you need to get in every single year. I mean, that's why the federal law says 1 year. You know, you can go online and get 6 years worth or something. I don't know.
Thank you so much.
Yeah.
I had a question
Sure.
about like the key points for when you were on that interviewing committee.
Mhm.
What was it that you were interested, like what were the things that you were keeping an eye on for those interviews?
I look for genuine. I like genuine people. It's not hard to feel. I mean, I don't want to hear how good somebody is. We already saw your resume. It's just like interviewing for a job. If your resume is bad, I mean, everybody looks good on a resume, right? And so an application should look outstanding. I first look for their mentors. Do we know them? Because guess what? The state of Oregon, I probably know 70% of the doctors in the state. And if you're at that level, you should know most of them. Because usually the membership director for the state's on that committee as well. So we look for recommendation. What they say, I want to make sure they have a knowledge of the profession, and I want to make sure that that it seems like they're doing it for, I hate to say the right reason, but for a compelling reason. Usually, like for me, I wear glasses since I was a kindergartner, so I get it. And if you get it, people go, okay, they understand. But my roommate freshman year didn't. But his dad had lost an eye when he was a kid. So some kind of personal story usually drives the reason people do for a living what they do. So look for those kind of things. You look for that a giving personality. And let's face it, people that are givers, you're going to see it in what they do and how they conduct themselves. Takers don't do, they're the ones, that, in my opinion, the takers are the ones looking for easy financial reward. And, they don't make the best community contributors, in my opinion. So. Yeah.
I have a question. So you know how they came out a couple years ago with the computers and like the reflectiveness of the blue light? Is that a hoax or is that?
That's a great question.
Because I wear them because I get like I work billing.
Oh, 100%. Yeah.
And so I'm always staring at the computer, and I decided to get one of those lenses, like those glasses, and I was like, I wonder if they're actually working or.
I would love to tell you a story about how a bunch of us from the profession got together with the computer people. No. It's interesting. I have a very different reason why I prescribe it than why I think the mainstream does. Mainstream's worried about UV light exposure. Okay, UV light exposure has been shown to complicate macular disease, such as macular degeneration. It's obviously the main cause of UV light is cataracts. So is it causing premature cataract growth? It's interesting because right now we know the basic years of standard age-related. So there's always a genetic predisposition with an environmental trigger. So the more light you're exposed to, you're probably going to develop cataract sooner. However, the amount of light that an LED screen emits compared to the sun is negligible. Okay? It's negligible. You're talking about a 300, I'm going to say 300,000, I don't know, more intensity issue than what a monitor does. However, we have sunglasses now. Our parents didn't. Their parents absolutely didn't. So are we going to see an incident in cataract change? We don't know. So they're starting to look, and in the last 10 years, we're starting to look at every environmental influence on health. I can't remember which president it was that put a bunch of money into environmental safety. I mean, it's interesting. However, what I can tell you, from the perspective of someone who works with kids, we're looking at a insomnia pandemic. We have children that aren't sleeping. They're to the point where we've got a lot of behavioral issues that 100% are not psychological. Some issue with their ability to process. It's no sleep, no nutrition. Well, we got kids drinking Red Bulls, for crying sake. Okay, we got little kids drinking Red Bull. They come home, they play video games for 4 or 5 hours. They go to bed, they're on their phone until they fall asleep. Well, here's the issue. UV light controls our circadian rhythm patterns. There have been studies done since World War II about people being indoors and having false light. So you put a kid on a screen, and this was a study done in, I believe it was 2009, by the American Academy of Pediatrics, where it stimulates their brain just a small amount, so a phone, an iPad, whatever. And the studies have shown, in sleep studies, that it prevents them from entering REM sleep. So there's I think 5 levels of sleeping depth. Well, REM sleep's when you enter it, that's restorative sleep. That's where oh wow, I had a great night's sleep. That means you got there. These kids never hit that. They stay right above it until it's time to get up. They wake up exhausted. They go to school, they're falling asleep in school, so they hit a Red Bull. It's this repetitive cycle. So the American Academy stated that its recommendation was to, and I'm paraphrasing, 2 hours before sleep cycle induced to cut all screen time. No UV light exposure. So a lot of kids, for gaming, especially with pandemic, we had so much homeschooling and everything, I really recommended blue blockers for that specific reason. Because if they're on it, it's going to change it. That way, the best shot of actually getting the rest they need and avoiding those issues. So hopefully that helps.
Yeah.
Yeah.
Any tips for just interviewing in general?
Just be honest. And I think the best advice I can give anybody is interview frequently. And I don't know, when I was at Willamette, and of course Willamette's a very wealthy school that has lots of resources. They had a business, or in the pre-med group, or club, I don't know, it's a club or whatever. We would hold, every quarter we'd have a little get-together thing. We'd bring in professors, and we would have just interview talks about subjects. In fact, one of the best things we ever did, it's a little unorthodox, but at Willamette, all the professors were publishing, researching. It didn't matter. We had a guy with 17 PhDs from Oxford. Okay, and I wish I could remember his name, but his degree was in medical anthropology. It was the craziest thing. He studied medicine through history. He was an amazing guy. So we picked 7 or 8 of these guys, and we would invite them to our fraternity house. And we had our room was a big room. And we'd make cocktails. And we'd pull subjects out of a hat. And we would all talk together about those things and our experiences, and we'd have questions for those. And you just get used to talking. All an interview is talking. That's all it is. It can be nerve-wracking, but you know what? I'm sitting across one of the smartest people that ever lived. Yep. and after a while, he was hey, that's John. No big deal. I mean, I haven't done this in 10 years. I used to lecture in rooms of 2,000 doctors I was 31, and I'm talking to these guys that are twice my senior, and what does he know about anything, And so, but it's just getting used to talking to people. And that's the greatest thing about my job. I interview people all day. So I would just say, there's no secret to it. It's just be honest and do a lot of it. Yeah.
Did you see more people losing their vision after COVID?
No, it's an interesting thing. After COVID, everybody was hypersensitive to anything. So, if you look at statistics, and this is where statistics are really amazing. statistics are only as good as the people that are putting them together. Everybody that died was hyper-analyzed whether it was COVID. And that's the hard part, because nobody really had a pulse on what happened before. And it is a well-known fact that a lot of people that died in car wrecks put COVID down because there was a lot of political and financial weirdness. I'm not going to judge it or classify it, but as part of a national group, I saw, and knowing a couple guys in Congress that were, the U.S. Congress, that were access to care representatives on committees and stuff, knowing that they were being literally threatened by the government to stop treating these people. And seeing the actual documents, I was like, whoa, wait a minute. There's a lot of uncertainty that happened. And whether it's real, if it's fraud, whatever it is, I'm a firm believer that anything that's real, humans can mess it up really easily. And so it either caused everybody to be all in believing it or 100% denying everything. So what I can tell you about my personal experience is that, first of all, the coronavirus has been around for over 100 years. People get the flu all the time. People get a head cold all the time. Your immunity determines your severity of symptomology. And so there was that, and there was something else. I'll say there's something else. I'm a background in microbiology, and having studied Fauci during my epidemic class and all that stuff, there was something else, because my neighbor, who was like my second father, who had diabetes, which I'm diabetic. I had diabetes for a long time, well controlled. He got a cough. A week later, it got worse. So he went in, they put him on a vent, he died 2 hours later. Okay, that was not some random virus. That was something else. Most things in nature aren't known to be that lethal. And who knows, maybe there was a predisposition condition he had. Maybe there's something they didn't know. Who knows? But to assume it was one thing or not, it's really tough to say. What we did see a lot of is people who got really sick, typically had some retinal issues, at least the ones that I evaluated, because the ones that had this typically had, quote, COVID or whatever. It's called MUDS, multiple effervescent white dot syndrome, right? MUDS, easier. And basically causes some swelling in the retina with some lack of vision, and typically self-limiting, goes away on its own. And I don't know if that's an aftermath to the viral particle loads in the vascular system. I know that my stepson had it, and Adam Oftaida, who's a retinologist in town, is a good friend of mine, and he said he'd seen a few of them, and I had seen them. I just wasn't sure what it was until I called him, and he goes, oh yeah, just keep checking them, it should get better, and most of them did. I didn't see one that, of course, my stepson, I sent him over to Adam just to make sure, but I wouldn't say I saw anybody go blind. I know that there was a lot of, let's put it this way, viruses are always going to be transmitted from upper respiratory into your eye. It's called pharyngeal conjunctivitis. There's the lacrimal system that drains everything down through the throat and the back of the, or nose and the back of the throat. It can go the other way. So upper respiratory, you're always going to see sometimes red eyes, goopy eyes. So I know that there was a big push for, hey, if you got goopy eyes, you got COVID. I really did. I can't state whether they did or not. We just treated them like they had goopy eyes. So
I had COVID pneumonia and lost my vision.
did it come back? Wasn't due to a stroke or anything, or a blood clot? Interesting. Who'd you see?
Medical lesson?
Did you see the retinologist, Lemon, or Savach? Yeah, as long as you get in there, and what did they say the reason for it was? They didn't know.
So I had
That's
20/20
unfortunate.
vision before,
Yeah.
but then I had COVID for like 4 or 5 months, COVID pneumonia, couldn't breathe.
And like I said, viral particle load can do a lot of different, the immune system's an amazing thing, but a lot of times it can hurt you. And if it goes unchecked and untreated, damage can happen, unfortunately. So I'm sorry to hear that. Yeah.
First of all, thank you for your presentation.
All right.
I wanted to go back to the phones for a second, the screens. How many years do you think it's gonna take before you see the effects of people looking at a screen every single night?
There has to be, it's sad, but I believe there has to be a financial impact that justifies the financial expenditure into the investigation. That's what it kind of shows over history. Like, what kind of loss are we dealing with that's gonna stimulate that kind of money being spent on research? Now, there are people doing research on it, but I can also tell you that the radiation emission on cell phones hasn't been updated in decades. So those phones that were safe back 10, 15 years ago, we don't know if the new ones are. We know they probably emit more radiation. So you've seen, there's a huge thing right now on Facebook, you see about the lady whose son had a brain tumor and they diagnosed that it was from cell phones. And the bottom line is, nobody knows. Nobody knows. And that's a question that's so hard to answer.
Would you be able to see that as an optometrist in your practice? Like 10 years from now, like, the rise of patients coming in have the same issues from that, or is that not something
You know,
it's just a
you could
correlation?
possibly do it. You'd have to have a large sample size of patients, and you would have to make sure that they're all evaluated the same. And a lot of our evaluation process is very subjective. You know, I always say when someone comes in with a cataract every year, and it's been 12 months since I've seen them, if I don't look at their previous record, it may fluctuate. It may be a +1 or a +1.5, +2, +3/4, depending on the day, even though it hasn't changed much. You're talking about minuscule changes over time. And then sometimes it gets bad really quick. They go, wow, my vision dropped. You look and you go, okay, there's the problem. As far as being able to determine that, it's a tough one. But I think if you had the ability to grade it specifically with the same accuracy or a small margin of error, and you had a large sample size, you could do a statistical analysis and see if it actually is increasing over time or not.
Yeah,
But it gets that technical, literally.
yeah, you'd have to start encountering 1,000 people and
Easily,
10,
probably
30.
10,000 people. And so, you know, when they do drug studies, contact lens studies, which I've been involved with many of those, over a period of time in 25 different clinics, each one gets 1,200 patients. And then you've got how many doctors? Like 30 doctors trying to do the same thing the same way. The margin of error is there, but hopefully the margin of error is less than the statistical relevance. Relevance. Jeez. So it's pretty complicated, and that's where people like us, there are people out there, they're medical statisticians. These companies, they all have them. And that's why when you smile when I said it, the statistics are only as good as the people doing the research and paying for it. Because there are a lot of people out there that want a certain outcome, and boy, money can make it happen.
Even if that outcome comes there, then private companies can pull that information too.
True, and you can always take information and retwist it to do something different. And that's where it's hard, because there's a lot of greed out there. There's a lot of things to win and a lot to lose. And so these companies,
Is there anything diet-wise that I can keep my eyes healthy?
you know, that's a great one, because macular degeneration has a lot to do with that. There's a lot of genetics that you can't control. But so we always try to focus on the things that we can. And I always like to tell people, have a colorful plate. Depending if you have certain grievances against meat or whatever. Lots of color, lots of vegetables, lots of chlorophyll, different types, and whether it's green, you got zeaxanthin, you got, you know, there's fish oil, there's all kinds of things. Antioxidants are the key to youth. But they gotta be good. There's a lot of scamming out there. Supplements aren't regulated. So you gotta know and look at the research and kind of understand what you're reading. I can tell you that when we treat dry eye and we get things for macular degeneration, we did it for years, and we had such mixed results, and then we settled on, there's a brand called Nordic Naturals. It's a Norway brand that's distributed in the United States, and you look at the percentage of the supplement that's bioavailable. How much is your body absorbing per volume? Okay, and that's different because we're all different. We don't absorb the same things the same. And there's a lot based on gender, ethnicity, age, water consumption. I mean, I take mine with water, I take mine with scotch. Well, guess what? It's going to absorb it, right? And so, again, you can only limit so many factors when you're doing any kind of comparison. So what I look at is, hey, are you seeing better? Is it more consistent? Are your eyes less running? Does your vision seem crisp? Does it seem like it fogs up? Those are all indicators of what we call anecdotal evidence. Evidence that nobody paid for a study cares about, but that makes a quality of life difference. So that's how, so lots of color. Keep moving, dude. I'm telling you right now, the key to not getting old is to keep moving. I'm almost 50 years old, and I look good because I'm Scottish. But some days I feel it, especially after being in the hospital 3 years ago for 2 months. It's still, I mean, I was a track runner in college and everything, so just keep moving, drink water.
Is there an advertised feature or fashion in eyewear that just drives you nuts?
Yes. The glasses that make people that are colorblind see color. That is the biggest farce, in my opinion, ever. There is nothing that you can do to change someone's genetic makeup from seeing a different spectrum of light to seeing the basic that most everybody appreciates. And it's sad because people spend $100, $200 on these glasses, and there is an advantage to it, but it's not doing what it says it does. It shifts the spectrum of vision to enhance color difference. So, deuteranopia, okay, is the difficulty telling the difference between red and green, okay? So you have two apples, one's red, one's green. You're like, they're kind of the same. I don't know which one's which. So you put this pair of glasses on, the difference in their color becomes starkly different, even though you can't tell what color they are. Does that make sense? So and that technology has been around for almost 100 years. They used to have the X-chrome lens. You'd wear one lens and one eye. It was a red lens. And so everything you looked at, one made it all red, one made it the other, so you saw the different frequency, the different nanometers of wavelength that you could appreciate. So that drives me nuts. The other thing that drives me nuts, anything that says it can do something that it doesn't do. Detoxing foot baths is another one. That's a different subject. But there's an eye drop on the market that I used to sing praises about. It's called Similasan. It's a naturopathic eye drop. And they had an anti-allergy drop, which worked wonders, and they had a dry eye one that worked wonders. You could use it with contacts because it didn't have preservatives. But they started coming out trying to hit the market with an anti-cataract one, saying that it would cure cataracts. And I'm sorry, if that were true, we would have the biggest upheaval from ophthalmology in the history of upheavals. It doesn't work. It might have lots of antioxidants. There'd be limited ability to even say it gets into the eye because to enter and penetrate the corneal surface, you've got to change the pH matrix. Because that's why most medications in the eye sting. It's because it has to change the gates so the medication can actually absorb into the eye. So, yeah, those.
How harmful are like lash growth serums like Latisse?
Latisse is not actually harmful, believe it or not. There are some things, I shouldn't say that. Inherently, it shouldn't cause a problem. It's bimatoprost. It's a glaucoma medication. And so the side effects from glaucoma patients are their eyes sometimes get red because it's a prostaglandin analog. So prostaglandins cause inflammation. So it's a medication that causes inflammation. So red eyes makes total sense. What it does is it causes the meshwork drainage on the sides of the iris, which you can't see, to inflame so they expand like a sponge that the holes get bigger, increasing the outflow of fluid, therefore decreasing the pressure in glaucoma. The side effects of it are if you have light-colored irises, inflammation begets the deposit of pigment. So pigment spots can occur on the actual iris. If you have brown irises, no big deal. It doesn't look much different. But when people put it on their eyelids, sometimes they'll get little pigment spots on the actual eyelid. The beauty of it is it actually absolutely makes thicker, longer lashes. In fact, when I have a male who's being treated but for unilateral glaucoma, I'll treat both because he doesn't want to look like Shim, you know, one eye and nail on the other. And, you know, I told him, your wife's going to be jealous of your lashes, so just be ready. So, no, I don't think it's dangerous, but like anything else, you should use it under the observation of the physician.
Thank you.
I had a question since
Yeah.
you had to leave here, but how young would you recommend like laser eye surgery?
Well, I can tell you my cutoff's 57 because cataracts form and things change. And so the surgery that's done on the front, it's on the front of the eye, not inside the eye. I did manage a LASIK program for the first 2 years of my career. It depends on the patient. They always say have a stable prescription. It means it can't change. It's interesting because I've worked with the military and they want them in as soon as possible. So they'll actually pay for it to be done in certain cases. Typically that age is 19. I would say it's probably between 19 and 22, somewhere in that range would be, depending on the patient. Now I can tell you for anybody who wants to have kids, the female variety, there's a strong chance that if you have the surgery and then you have a child, that your vision's going to change. And that's because the human growth hormone active in the baby and the growth of the baby will cause, in many cases, cause your eye to get elongate, making you more myopic. I've seen it, my wife, when she had my stepdaughter, had that happen. She had LASIK and then she went to a -2. Some people, they don't have that problem, but you're rolling the dice. So does that answer that question?
Yeah, thank you.
Yeah, so basically some kids, some 19 and 20-year-olds that are, quote, late bloomers tend to have hormone change later into their mid-20s. So you got to just be kind of aware of that.
You were saying something about nursing missions, what exactly?
Like, for instance, there's Bosch International is a very common one. What is it? Countries Without Borders, Northwest Medical Team. They go into underserved areas in the United States as well as in different countries, typically third world countries. Mexico's a big one because it's close by. And they'll either do free medical care. We've seen cleft palate reversal. You dropped something, I think, your phone. See, I got good eyes. In our case, depending, I was invited with Dr. Schultz to go to Peru and do at Cusco to do some cataract outreach, and then we were going to hit Machu Picchu and the Amazon, but COVID happened. There's just a lot of opportunity to help, and it's an enriching experience because, like I said, if you're going into the boondocks, like I've had friends that have gone in the middle of the jungle in Honduras and did outreach to some native descendants of the native tribes there, and there's no care, really health care or anything. So they'll take a couple doctors, a couple optometrists, they'll take a supply of glasses, maybe an ophthalmologist, and they just go and do what they can.
Tell her what Matt does.
Oliva?
Yeah.
So Matt, when I first met him, he came from Seattle originally, where he was kind of experienced some outreach stuff, but Matt created what's called the Himalayan Cataract Project. He used to go to Kathmandu, was their base point, and they would go out into the absolute middle of nowhere and do cataracts. They would find people and bring them to a medical village that they'd set up, and they would do cataract surgery for a lot of these people. In fact, there's a school there, I think it's the Galaxy School or the Star School. It's a famous school in Kathmandu, and we were going to, at one point, we had talked about going and doing a pediatric clinic for those kids. But again, Nepal was had a lot of civil unrest for a long time, and it's pretty unpredictable. So he would go based on when it was safe, quote unquote. He also does a lot of, I think, in the recent years, outreach in Africa, Ethiopia specifically. And Matt's a great guy. If you ever have a chance to see some of his talks, I know every once in a while he'll give one. You do your surgery? Yeah. Matt's outstanding. When he first came to Southern Oregon, I was at Eye Care Group in Grants Pass, and he was the main guy at the Grants Pass office. And he was my go-to. Everything that was odd and beyond went to him. And we used to have lunch all the time. And I remember, it's been years, now he's the horse. He's the main guy in medical eye in Medford, and it's funny, our boys were playing basketball against each other, and I saw them in the stands, and I hadn't seen them in about 6 years. Talked to them, here and there, but no, it's good. But there's some great people in this town. I mean, we're very blessed. You hear a lot of stuff about we don't have good medical, but man, I tell you, the people that are good, they're good people.
I got a question.
Yeah.
What can be done to offset or kind of prevent macular degeneration and glaucoma? Someone who might be on risk at markers.
So glaucoma, get checked. Get checked. Start now. Get checked. Let them know. Family history glaucoma. There are places that, in my opinion, the overkill. I want to see every 3 months. Okay, well, that's a little overkill. If you're doing some testing and it looks risky, see them in 6 months. If it still looks risky, see them in another 6. If you're looking at someone and they're looking pretty good, just stay in touch with them. Hey, I want to see you in 6 to 12 months. Glaucoma is the silent stealer of vision. When half of the loss is there, you might see it. And therefore, especially in my grandparents' generation, the people in their 80s and 90s, they're very suspicious of modern medicine. So when I tell them, hey, you've got dry eye and their eyes are watering, you're a quack, they're not dry. Well, it's reflex tearing because your eyes are dry. They don't get that. But, so that's the kind of attitude still. So I tell them, hey, your pressures are too high. But there's 5 other types of glaucoma. There's several types of glaucoma. Some have normal pressures, called normal tension glaucoma. So glaucoma, we're beginning to find out it's more of a vascular perfusion issue than a pressure issue. Pressure is what we can control. So early detection, absolutely. So if you have a significant family history, let your doctor know, get checked. Okay. We have 3 amazing glaucoma specialists in Southern Oregon. So some of the top in their class. Justin Spalding, who's a cataract and laser. He's really into MIGS, which is minimum invasive glaucoma surgeries. Microsurgery, amazing. We've got Helen Koningsman at Medical Eye Center, who's phenomenal. I think Paul Uritza just retired, and he was another one. As far as macular degeneration, that's the big one. That's the term everybody's jumps at right now, just because it's so devastating. There's a lot of studies being done. I can't quote any of them because I'm not photographic like that, but there's some strong evidence in a couple of studies showing there's a lot of mitochondrial DNA association, and that would mean women direct and relatively near descendant. So grandmothers to mothers to daughters, or grandmothers to granddaughters. That if you're a woman and you have somebody in your immediate family that's female that has it, even if it's your aunt, get checked. There are a few genetic tests out there. I have a suspicion there's quite a few different versions of MACD. I've seen genetic versions where people in their 40s get it.
Is that X-carried?
Why? It's hard to say. I'd have to actually look at the report and the statistics. It probably is.
Anything dietary, anything supplemental?
Well, yeah, I mean, like anything else, a lot of these diseases are hyperoxidation. So what's the #1 cause of macular degeneration?
What
Smoking.
is that?
Smoking.
Oh, really? Okay.
Yeah, in fact, I worked with a retinologist in Redmond, Oregon. He was the only retinologist within 200 miles every direction. His name was, I can't remember his first name. His last name was Dr. Barini. And if someone was still smoking, he wouldn't see him. He'd say, once you're done smoking, come see me. Because anything I tell you to do, you're going to completely undo. And there's some wisdom to that, because one of the frustration of doctors is that they can't fix you. They can show you the tools and the way to do it, but you have to step through the door. And if people aren't willing to step through the door, he's like, why should I bother?
Right.
And he was kind of, he was jaded. He was just overly worked. But lots of color on your plate, lots of antioxidants. Drink water. There's a huge kick for hydrogen water now. I'm not sure if there's a huge correlation, but anything that can eliminate oxidation from free radicals is going to be a benefit. Because the main cause of MACD is Brooks membrane behind the retina polarizes. Nutrients can't get into the retina and waste can't get out, or is retarded either way. So drusen, which are pockets of waste in the macula, are usually the first sign there's probably a problem. Now, there are many conditions out there that have drusen that aren't macular degeneration. But most macular degeneration has drusen. So, except, you get to the wet version where you got bleeding associated, and that's that's the one we can treat, because angiogenesis, when you have toxification, cytokines or little chemical messengers are released, and you get the angiogenesis, these new blood vessels that come to the area to help. Well, they're poor quality and they tend to leak really quick, and that blood eventually will scar. So you've heard of Avastin, maybe it's an injection that goes in the eye. It chemically cauterizes those vessels. So that's typically the treatment nowadays, what people do. And there's a lot going on, and I mean there's a lot of things that can be done. I know we could talk all afternoon about macular degeneration, but
Yeah.
one of the key things that I look at in dry AMD, wet, they go to ophthalmology. Dry will tend to follow them a little bit until they start having some significant vision loss, but usually it's fish oil, zeaxanthin, lutein, magnesium. There was what's called the ARID study, the age-related eye disease study. There's been the first one which found lutein became a huge thing. Oh, I want lutein. And then the second one showed that actually fish oil is more potent of an acid oxidizer than most of all of everything. So if you're ever going to see someone that might have MACD, or if you have a significant family history of it, taking an ARIDS 2 formula vitamin supplement is not a bad thing. In fact, if I know someone that's 50, 60 years old, and maybe their parent has wet AMD or dry really bad, I'll say, hey, start it. Anything you can do to avoid, but with anything else as a health professional, you got to be careful, because most people aren't going to be totally 100% accurate in what they take. You don't want someone overdosing on a certain vitamin. Now, there's some you can't, and there's some that are very touchy.
Right.
So you always want to that's why that network of knowing the doctors in your community. If I've got somebody unquestionable, I'll just call the doctor and say, hey, this is what I'm thinking of putting them on. Is that good or not?
You were talking about the Nike Max site. What are those?
So Nike Maxite, one of the biggest issues we found in college athletics was playing at night under sodium fluorescein lights. Or no, not sodium fluorescein. Sodium, I don't remember, it's been years. But they're that yellowish kind of, they come on slow. Used to have them in the gyms at schools and stuff. And they have almost a yellow light. Well, a white ball flying through against a black background with the sky and stuff, it's hard to track. It's really tough. So sports vision is based on the predication of what you're trying to do is shift the wavelength of appreciation so it causes a bigger contrast. Increased contrast causes an increase in acuity. The reason why golfers are so amazing is their contrast sensitivity is huge. Therefore, they have very good vision. So when you're golfing, if you ever golf, you see a green flat with a flag in the hole, right? Well, when they're looking at it, they see multiple colors of green. They see the rise and the run and all the slight changes, which is why they're typically such good putters. As far as baseball, what it allows is you can track a ball better, but really there's no such thing as tracking. If you're hitting, you don't track it. You're anticipating the trajectory, and timing is everything. So the better you can see it at point A, B before you swing, the more successful and accurate you're going to swing. So, and not to mention, if you've ever played golf and hit a long ball, you'll lose it after about, 70 yards. And if you have these in, you can see it the whole way, all the way till it hits the ground. I always have to go, where to go? So, yeah, so all kinds of possibilities in improving vision.
You said that the patent got sold and someone else has it. What's
No, the
name of
patent wore out. They're only good for so many years. And Nike got rid of the product well before the patent ran out, or whatever their key licensure was. But the guys who created it recreated it under their own company called Altius, A-L-T-I-U-S. It's distributed by AB&B Optical, which is a contact lens buying group. The green one was actually one of the best sports it was used in was tennis, because it made the yellow ball glow really bright. You're welcome.
Thank you, sir.
Yep, you're welcome. Yep, take care. Best of luck to you. Yep.
It wasn't correct time to mention it, but
Yeah.
my provider, Dr. Wrights, over by Big Five, is one of the digital planning staff.
Who?
Dr. Wrights,
Rice.
and she probably could be.
Oh,
She could be your.
Shahida?
Probably, yes, could be your low vision person as well.
I wonder, I've known Shahida since I was a student. She used to be in the mall for like 15 years.
Yeah, they tried to kill her.
Yeah, I know. I wasn't surprised she left. She's from Grants Pass, actually.
No, she wanted to take care of people and they wanted to.
Yeah,